Welcome to Let's Eat. I'm your host, Emily, holistic health coach and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the exact location where optimal wellness lies. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hello, everyone, and welcome back to Let's Eat. Today's episode is going to be driven by personal experience, and I feel like this topic itself has become more relevant to me in my life just within the past year. I shared about this on Instagram last spring, very briefly, but it's a topic that I feel might resonate with some of you. I certainly know I have a close girlfriend of mine who experiences very similar feelings, and she and I have really been able to lean into each other over the past year as we both navigated new health issues that we haven't really been able to get answers to. And I think it's very vulnerable to discuss this topic as a health coach, because a lot of this kind of compromises my identity to some extent, or maybe I have the illusion that it compromises my identity. I guess it really doesn't, but in my mind it does, right? So that obviously drives these negative emotions a little bit more and kind of amplifies the emotion, because not only do I experience these emotions, but I also have a lot of my identity embedded within health and wellness, as you all know. So it really puts me in a difficult position, and maybe doesn't necessarily put me in a difficult position. I think I'm under the impression that it puts me in a difficult position. So I really want to be sure I highlight the difference there, that there is in fact a difference. So today we're going to be talking about health anxiety. Okay, and talking about what that means. I'm going to define it in my own terms as it relates to my experience, but I also want to give you the formal definition of that, because most of what I'll be talking about today has to do with my personal experience with it. But I think to give you also the formal definition and to explain how it manifests would be helpful too. So to give you the formal definition, this is from the Anxiety and Depression Association of America. Health anxiety is a fear and preoccupation with the belief that one has or is in danger of developing a serious illness like cancer, ALS, or a heart attack. It involves the misinterpretation of normal bodily sensations as dangerous. Healthy bodies produce all sorts of physical symptoms that might be uncomfortable, painful, unexpected, and otherwise unwanted, but not dangerous. Now, something I want to also expand on here, outside of just this definition, is the anxiety that can come from the waiting game of our healthcare system, from the uncertainty of our healthcare system, from the invalidation of our healthcare system, from the misdiagnosis that can come with our healthcare system, or the tendency for our healthcare system to throw out different diagnoses without really any formal, investigation of this could be this or that could be that. I think all of these factors put together really do cause a lot of anxiety in we as Americans, as we as individuals who utilize a healthcare system. Now, I am speaking from experience, especially within the last year. I'm speaking from the experience I've heard of others. I'm not speaking on behalf of everyone, but I think it's fair to talk about my experience when it comes to this concept of health anxiety, this experience that was very real for me and still is very real. and possibly validate your experience to some extent, offer you maybe some strategies in navigating those experiences, as you know, a lot of health anxiety can be supported through modalities and strategies that you might use for any other type of anxiety that you might be experiencing. Now, my story around the health anxiety starts most notably, most prominently last June. I shared bits and pieces of this on Instagram, not a whole lot, because I really wasn't sure what was going on, and still to this day, I'm not totally sure what was going on. And obviously, I've been in the health and wellness space for several years now, and I've been very lucky that I haven't had anything happen to me that wasn't able to be diagnosed, right? When there's a diagnosis that comes with a symptom, that comes with a circumstance, it comes with something that's going on within the body, that's what we all want, at least for the most part, right? I would say that the majority of us want the diagnosis so we can understand, okay, then what's the course of action? Now, the course of action will vary based on holistic wellness versus Western healthcare and so forth. Oftentimes, you know, an approach to one chronic illness or one issue or infection or whatever it is, right? It might look differently based in these two schools of thought or these approaches to health, but that's not the point here, right? The point is that when we can get a formal diagnosis of, yes, this is what's going on, we feel a little bit more at ease. And that's part of the reason why diagnosis exists, right? Is because we want to know formally what criteria is being met to then warrant this diagnosis, and then what is the plan of action that is most appropriate for this diagnosis. And that's very much Western healthcare, right? We're not individualized, we're not personalized, we're not really considering any specific, you know, health history or someone's genetic makeup or, you know, someone's life circumstances. We're not considering those things. We're not considering someone's nutrition, lifestyle, and so forth. We're simply looking at, by the book, this is the diagnosis and this is the plan of treatment. So for me, back in June, I started to have this bizarre lower abdomen burning. And it started a couple days after I had gotten my period. And this was mid-June. And over the course of the month of June, right, I'm also anticipating a move at this point in time. All right, I'm moving in July 1st. And so these last 2 weeks of June, I am losing my mind to the point of tears every single day, feeling so confused on what is going on. Nothing was helping it. I didn't know what was going on. And I was losing it. Now, I will say that being an already anxious person, right, I was not helping the situation. What we know is we have a tendency to worry about our worry, right? And that can make matters a lot worse when we start to have anxiety about our anxiety. And so I am now essentially spiraling and ruminating and trying to work through, okay, what could it be? I'm Googling, which we all know, Health 101, we should not be Googling anything. Do not be Googling your symptoms, friends, okay? That never ends. That never ends well, all right? We all know that. We all know that. I've learned that the hard way. Is not a good idea. So I can't really specifically give you, chronologically what that last part of June looked like in terms of visits and so forth, but I saw my primary care doctor at the time. It was a healthcare provider that I'd been seeing for years, okay, since I was born, essentially. I have documentation from this doctor's office from like 2000, okay? I've been seeing this practice forever. And I remember being there, and I had said I have a history of ovarian cysts. I had one ovarian cyst, and I assumed that might be what was going on, okay? So I saw the one doctor. I had left work early to get to this appointment because I was losing it. I could not function. I could not focus on what I needed to focus on. I could not function without talking to someone and figuring this out. So I go see this doctor. This is mid-June, and she sends me on a whirlwind of, well, it could be this, it could be that, it could be this, that, this. And I said, girl, you just named literally every organ in my body. How could it be all of these things? Like, I understand that we're trying to kind of investigate a little bit further, but to me, that just seems a little bit, you know, aggressive to be so forthcoming about all that it could potentially be. But she had some pretty solid confidence that an ovarian cyst was what was going on. Okay, so at this point, I schedule to go get an ultrasound from my gynecologist, which I'll preface this by saying I don't see a consistent gynecologist because every gynecologist I talk to wants to put me on birth control. So when I go see the gynecologist for my annual, they ask me, who do you usually see? I say, honestly, I don't know who I usually see. I just come in to whoever's available and they'll say, oh, it looks like last time you saw so-and-so. I'm like, all right, yeah. That's fine. The quicker I can be in and out of this appointment, the better. Because I just don't feel like being guilted or shamed for not being vaccinated, number one, and for not being on hormonal birth control. So I go see this doctor, get the ultrasound, no signs of cyst. Okay. Meanwhile, I go sit down with the doctor and she goes, well, we could try a trial run of birth control. And in my head, I'm sitting there, I'm like, but why? Like, literally, why? Like, I think that's a valid question. Why? Why would we do that when we do not know what is happening here? For her to utter those words without any real understanding, could be gynecological in nature or not. And she's just saying we could just try a trial run of birth control. I bit my tongue. I said, no, thank you. I'm not interested. I said to her, though, out of my space of anxiety, right? Because at this point, it's been probably a week. And I know a week is not a long time, but to sit in this pain and this discomfort and not know what's going on, I was really losing my mind. And maybe I was showing up to Instagram as normal. I definitely was feeling just a loss of motivation to do anything on social media because I was feeling so anxious, right? To kind of sum up this episode about what was going on. Why was I feeling this way? And like I said, up until this point, I've been very lucky. Now I know I have a history of antibiotic use. I have a history of, drinking and stress and so forth, right? So part of me wondered, okay, maybe all of that is catching up with me. Maybe there's something going on in my gut. I don't really know, but I'm going to figure this out. So in my state of anxiety, I said to the gynecologist very vulnerably, I take such good care of myself. I take so much pride in my health, and I just really need to know, what is going on. And I know she obviously couldn't give me the answer there, but I was looking for validation. Some validation. And she says to me, well, yeah, all of that really doesn't matter. And I said, no, it does. It does. And so this is my opportunity to reinforce what I've always said. Genetics load the gun and environment pulls the trigger. And if that is the only thing you take away from today's episode, which I hope you take away a lot more, but if that is the only thing you take away, that is the message I want you to hold on to. Because I am sitting with a healthcare professional who means well. I have obviously nothing against her. Couldn't even tell you her name. I don't even know who this person is because like I said, I don't see the same individuals. And she says that to me. Talk about how invalidating and how frustrating it was for me to hear that, where I'm sitting there so upset and so anxious, just looking for someone to validate my concerns. And she had the audacity to say to me, no matter what you eat and how you live your life, it does not matter. It is what it is. Now, I don't want to say that that's 100%, it's foolproof, right? Obviously, there are certain cases where, things do happen, okay? So I'm not trying to say that she is wrong maybe for saying that, but I think part of it really just got to me because I do take pride in the lifestyle that I lead. And for her to say that back to me, especially just because I know that that's what Western healthcare professionals, that's the type of philosophy that they know. They know pharmaceuticals, right? It was really hard for me to sit there and just say, Okay. So she did a urine sample as well, just to see if there's any kind of infection, no issues there, so forth. So I'm on my way. I get in the car, and I get on the phone with my mom, and I'm crying, and I'm like, well, what am I supposed to do? I think at this point she had suggested that I go see her urologist, maybe see something with my kidneys. I think at this point, because I hadn't had annual blood work done, I was due for a physical. I scheduled that with my primary care doctor's office, and that was maybe for like a week and a half. And at this point, I just felt so paralyzed. Now, there might be some of you who are listening right now that are, saying, oh my gosh, you're so dramatic, relax. But I also think that this does a good job at illustrating how intense health anxiety can be, right? Especially when I'm feeling almost like my identity is shaken a little because of the fact that I do invest in my health. I do take care of myself. And so now it's like, what more could I have done? What did I do wrong? And so I'm putting a lot of this blame on myself. I'm putting a lot of the blame on me, and that's really impacting the relationship that I have with myself, number one, but it's also shaking me at my foundation, about all that I've ever known, my belief system around health. Once again, it might feel dramatic, but when you're in the midst of that anxiety, these feelings are amplified. They are really real. And I have no idea what's going on. All I know is it's distracting me. It's causing me a lot of distress. I'm having trouble sleeping as a result of it, all of the things. So I go another maybe couple days, and my anxiety took over. I ended up going to the emergency room because I knew at that point that was the only thing that I could do. Now, I want to also state that throughout this whole process, it can feel very isolating when you feel as though you have such limitation in terms of what you have access to in regard to the healthcare system. Because what I know is I want to test what's going on in my gut. I want to know what's going on. Give me a full blood panel, right? Give me all the information that I would like to freely have access to within our healthcare system that align more with my belief system about health, right? I want to understand what my hormones look like. I want to understand what my gut health looks like. I want to understand all of these factors that are not as easily accessed by our healthcare system as they would be if I were to see someone maybe in functional medicine or someone who's more integrative. So I've also was feeling that isolation, or it's kind of like I can see it and I know that it's possible and I know that it's there, but I don't know how to access it. And that was also very hard because I feel at this point, well, these are my options. Right? I see my primary care doctor, I go to the ER, I do X, Y, and Z, but these are all, options that really don't align in the way that I see health. So I feel like I'm on this parallel of, going by the book of Western medicine, but I can see all these other options on the other side. I just don't know how to get to them. The best way of putting it is they don't speak my language. And that is the best way of putting it. It's like a different dialect of the English language that I'm up against here in trying to navigate my health issues or whatever it is that's going on within my body with providers that don't see it the way that I see it. And I don't even know how I saw it. I just knew that, if these are my only options, then these are my only options, right? And I wanted to know what was going on. And so it was kind of futile to some extent, where I knew it was more just an impulsive reaction to having anxiety. And I was desperate. I just wanted to know what was going on. Why was this happening? Worst case scenarios out the wazoo, right? All I'm thinking about is what this could be. And it was tough. So I ended up at the emergency room early hours of the morning, one morning. And they did another ultrasound just to look at my ovaries. But I remember saying to them, I already had this done at the gynecologist. I don't need this ultrasound. And I was in the ER. They brought me to the ultrasound. And I said to the ultrasound tech, I said, I had this done last week, so I don't think I need to do this. And of course, they're supposed to follow the order. So the order said this was the ultrasound that needed to be done, okay? So of course, through this ultrasound, nothing was found, as we already knew. We already knew that nothing was found. But why we were not aware that they were duplicating the same ultrasound is beyond me. Okay, so I'm brought back to the ER. At this point, I'm explaining my symptoms to the doctor. The doctor's asking me a bunch of questions. Finally, he spits out, have you ever thought maybe endometriosis, right? This might be endometriosis, which for those of you who don't know, endometriosis is essentially when you have tissue from your uterus that grows in other areas of your body. It's a very painful condition. It is a very common condition, but it takes a long while to get a formal diagnosis of endometriosis because diagnosis requires surgery. And in order for them to confirm that endometriosis is the case, surgery would be needed. So it takes time. I did even a training on this many years ago, which is wild. I have notes on it somewhere on my computer. But it takes a while to get that diagnosis. But the doctor just so freely said, yeah, maybe endometriosis. I think he may have suggested a couple other things. I can't really recall what it was, but there was no sign of infection, nothing wrong with the ovaries. He told me to monitor it, take Advil to monitor, manage the pain, and you're on your way, okay? So at this point, I'm now waiting for my blood work, and I'm trying to piece it all together. But in the midst of this, I'm supposed to be excited. I'm moving, right? I have my own space and so forth. I'm supposed to, be excited for this. But I'm also in a tremendously anxious spot because of the fact that I don't know what's happening here. And I think what was so bizarre to me was the fact that it was predominantly in my lower abdominal area, but then I'd find it would shift, which was so confusing. It was so confusing. I then started to try to make connections between certain things I was eating, certain things I was drinking. I was trying to figure out all the things. So at this point, I think I went and saw my primary care doctor to get blood work. And according to my blood work, everything looked okay. Now, looking back, I don't think everything looked okay because I know my vitamin D was definitely low and has been low for many years. For those of you who haven't had your vitamin D checked, please go get it checked because according to my blood work from 2019, I had low vitamin D and no one told me that I had low vitamin D up until this past summer. I started supplementing and so forth, and a lot of us are deficient in vitamin D, so just as an aside. But I forget kind of what happened next, but all I know is in the midst of all this, I get my blood work done. I think everything came back okay. I'm overanalyzing any slight number that was low or that, was elevated because, of course, I'm looking at this and I'm like, okay, something's got to show here, right? Something's got to explain what is going on. So at this point, I'm now in this spot of my one doctor is saying I should go see a gastroenterologist. He's also suggesting I should follow up with a gynecologist. I'm now being referred out to specialists because nothing really makes any sense. Okay, nothing adds up here. I'm thinking now we're moving into July. So at this point, I've moved into my now home. And I was very depressed. And I'm imagining it was because of the fact that there's a massive transition happening. I'm living on my own now. But I remember that first week going to bed, the sun was still up, and just laying in bed and feeling so lethargic and depressed because I was so stressed out about what was going on. I didn't understand. It didn't make any sense to me. I was hyper conscious about what I was eating, what I was drinking, what was triggering the symptoms. And there was just a million different thoughts and scenarios that were just consuming me at all hours of the day. I lost interest and motivation in my business. I lost interest in doing anything because I just felt so discouraged and frustrated by the fact that no one could help me. no one could tell me what was going on. And I think what was worse was everyone had something to say, right? Everyone wanted to give me something, which I get is their job. They're trying to support me. But no one could give me an answer. And no one could direct me in a direction that made me feel like, yes, this is the right direction. So at this point, one of my long-term followers, which I hope that you are listening to this because you are the greatest, she reached out to me and she suggested I go see this doctor, an integrative doctor who she had been seeing, had great success with, wonderful experience with, which is actually really funny because I've now referred probably 3 or 4 people to her because I do love her, but local to my area, and said you should go see her. So I made an appointment to go see her. I want to say this was probably end of June, beginning of July. So this is right about my move. So at this point, I'm still kind of seeing my other primary care doctor. But if all went well with this new doctor, she was going to be my primary care doctor, hands down. Anyone who was more aligned with my belief system and anyone who spoke my language more fluently, okay, in terms of holistic integrative health, was someone I was going to gravitate towards. I think I had been seeing this doctor for years and years and years and years, this practice. Now I've seen a couple different doctors within that practice, but the one doctor I had been seeing for literally my whole life. All of my siblings saw this doctor. I'd been going there forever. He knows about my brother's medical history. I mean, he always asks about my mom and what, I'd known him forever. So I think when it comes to navigating these changes as an adult, I don't think we always consider, I'm an adult. I can change anything. I can change who I go see for my dental work. I can change who I go see for my doctor. I can do these things because I'm an adult and I have the choice to do this. So that was kind of the realization I almost came to, because now that all of my siblings are no longer living in New Jersey, in this area, my mom doesn't live in New Jersey anymore, I, really decided, I can make a choice to make a change. I think the reason I had it was because I was going to the doctor so infrequently that I didn't really even give it some thought. I was like, well, if I need to go to the doctor, I'll go to the doctor. I'll do what I have to do and I'll leave. But now that I was navigating this, I'm like, I don't need to do this anymore. I can go find someone who aligns more with my beliefs. So this is another aside. As we navigate this episode, I'm just giving you kind of tips. If you are unhappy with your healthcare provider, your primary care doctor, your gynecologist, whoever it is, go find someone else. Go find someone else. And if you align with my belief system about whole body health and holistic medicine and, treating ailments at the root as opposed to the symptom, that is 110% a reason for you to remove yourself from a primary care doctor who's going to simply suggest symptom-based solutions and find someone who aligns more with your belief system about health. And I know that those are harder to find. I'm not going to deny that. And sometimes they're not covered by insurance. And I know that all of these factors play in and proximity and so forth. But if you are unhappy with the care that you're given, you have every right to say, I'm going to find a different doctor. I'm going to find someone else who can speak the same language. And that's exactly what I did. Okay. So at this point, I'm in this kind of overlap of a transition, still kind of relying on my primary care practice, to give me my blood work and to kind of follow up to some extent. But then I'm also transitioning to this new care. So I see this doctor, immediately I feel 100 times better. Okay, I tell her I'm a holistic health coach. This is my story. This is what's going on. I'm not getting any answers. And, she and I start talking a little bit more at a granular level about what could be going on. We talk gut health. We talk hormone health. She mentions potentially estrogen dominance. We talk about, issues within the gut, how we could do a GI map, which will help us look at what's going on through a stool analysis within the gut, especially with my antibiotic use. So I'm already leaving this doctor's appointment feeling 100 times better, knowing that there's someone who's going to meet me where I am in terms of what I see from a health perspective, and hopefully guide me in the direction that I need to go in order to feel better. So I forget exactly what happens now after all of this. Okay, I think I cut ties with my primary care doctor from the original practice. I do believe I scheduled a CT scan per her suggestion, which I think was initially denied because they wanted an ultrasound first, if I remember correctly. So I'm not really sure how that unfolded exactly, but I do remember getting a CT scan and everything coming back okay in the CT scan. Now, we're talking end of July, I get the CT scan. Okay, so I'm now moved in. I'm spending the whole month of July sitting in my health anxiety about what is going on. And obviously the doctor that I'm now seeing, she says, track your symptoms, look at patterns. Could it be food related? She's really giving me all the suggestions in the meantime. We did test my hormones. Nothing came back problematic. Originally, she had suggested maybe PCOS was a player here. Nothing, that indicated that. So I get my CT scan. I'm counting the seconds to hear my results. I am just eagerly awaiting these results. Doctor's office calls me, says, Emily, everything's fine. There's nothing going on. So part of me was very relieved, right? Because that's a very anxiety-inducing process. But the other part of me was like, but then what am I supposed to do? What am I supposed to do? I don't know what I'm supposed to do here. Okay, so now we're already through the summer. I remember, like I had mentioned in the beginning, my one best friend, she came over and we sat on my deck and we probably talked for 3 hours about health anxiety and about how she had lost someone recently very close to her, very young, very unfortunate. And that definitely fueled her fire of health anxiety. And she's very much someone who takes care of herself. She is, a big believer in holistic wellness and eating the right foods and non-toxic living and so forth. And we sat on my deck and talked and talked and talked, and we drank our mocktails. And I'm so grateful for our friendship. I always have been. We've been best friends for over 10 years now, and she's wonderful and she's the best, and she knows who she is. So this is my shout out to her. But we spent so much time talking about this because I was going through what I was going through, and she lost someone very close to her at a very young age. And I knew this person also, obviously not nearly as close as she had, in terms of her relationship with her. But that really causes you to reflect on obviously how short life can be and all of that, but also health. And so her loss fueled that fire of health anxiety. So we shared this commonality and, really just talked about how consuming it is, how consuming it can be. So moving into, I believe this is now August, and we're talking about this concept called estrogen dominance. And at this point in time, I've done genetic testing. The testing that I used was by 3x4 Genetics. I will link it in the show notes. It's best done with a practitioner, I will say. I received the results on my own, and it's very user-friendly to understand as far as, the terminology, the way they break down your results. It's all in layman's terms, right? You can understand it, but it's better interpreted by someone who understands this genetic testing, and they can offer you further guidance, supplementation support, lifestyle support, and so forth. So just as an aside, but according to my genetic testing, I have poor detox pathways. Okay, so I need to do extra support there. And then I also have the MTHFR gene mutation, which comes with a couple different vulnerabilities and considerations to be made in terms of supplementation and so forth. It's a very common gene mutation, but it just begs the need to be a little bit more intentional about what I'm supplementing with and what this, heightens my risk for and so forth. And there was a couple other, genetic markers that I want to bring to my attention moving forward. So this led her to potentially suggest that there might be something called estrogen dominance taking place. And estrogen dominance is essentially what it sounds like when estrogen builds up within the body. And this is a type of hormonal issue because we know that we have a very delicate balance of hormones. And so she suggested a protocol for me to get started on to help clear that excess estrogen. Okay, so I started the protocol and it really helped my symptoms. It really helped. I don't know what happened, if it was just a coincidence, but I started these supplements and it really helped the situation. Now, at this point, I also cut back on my caffeine. I cut back on my citrus because there was also talks of potentially something called interstitial cystitis, which is essentially autoimmune of the bladder. Now, I have a long history of bladder infections growing up when I was younger into my adolescence. So it wouldn't be totally shocking if I also now have some sort of issue with my bladder as an adult, okay? This is something that is a little bit more complex because there's really no cure for it. It's just about managing it. My doctor had said that they have had some success with hypnosis and a lot of mind-body work in putting this issue into remission. So we're kind of toying around with a couple different concepts, but concepts that were never introduced to me by my original healthcare provider, right? He jumped, or this is just the ER doctor, but he jumped right to endometriosis. Okay, estrogen dominance, let me tell you, it is a very common, very, very common issue. It comes along with painful periods, and there's a number of other symptoms that manifest when estrogen dominance is an issue, and we find it so common because so many of our livers are compromised. Our toxic load is through the roof, through the products we're using, environmental toxins, the medications, all of the things. And so our body has a hard time breaking down these hormones, and as a result, it builds up in our system. So started taking these supplements. This helped a lot. Now, whether it was just a coincidence, I don't know. But I think I went another couple months at this point where I was okay. I was not symptomatic. It would kind of come and go, but I was kind of managing it. And I will be honest, I kind of just let it go to some extent. To some extent, I just said, I just spent the entire summer caught up in this health anxiety. CT scan proves nothing's wrong. I've had ultrasounds. I got blood work done, right? Nothing is showing immediate danger or concern. So let me just take a chill pill. Okay. I think I just exhausted myself from it all. And this is something that I want to encourage you with. Now, I know I'm talking about health anxiety and my own experience, and then I'm kind of intermittently sharing some strategies and tips and so forth for you to utilize. But always look at the facts. Okay. This is something that we do with clients when experiencing anxiety. You always want to look at the facts, because when we check the facts, which is actually a skill in dialectical behavior therapy, we oftentimes realize that we're making up thoughts, or we're having these irrational thoughts that are not factual. They're not factual. And this applies to health anxiety too, right? I looked at the facts of the testing I got done, of, what I know to be true, and nothing reflected anything that was alarming, concerning, that was pressing for me to get addressed. So these thoughts do not align with the facts of the situation, that nothing was immediately at risk here. My life was not at risk. I was not in any danger. Now, this is much easier said than done, of course, and that did not diminish the fact that I was still having symptoms, right? So still something was going on, but I wasn't sure what it was. And I think I was still clinging to that kind of interstitial cystitis conversation, which was going to be something that I would have to just work on as kind of like a lifelong journey, for lack of a better word. And something about this interstitial cystitis is it's an exclusion diagnosis. So it's really about, okay, it's not this, that, or that, so it must be this. There's no real formal testing to confirm that this is in fact the case. So I move my way through the fall. I follow up with my integrative health doctor. She suggested that we do a GI map at that point. I think this was probably maybe September, October. I say, I'm going to hold off. I'm going to wait and maybe I'll reconsider. Okay. So come December, January, my same best friend comes over and we're sitting together and she goes, Emily, I am having the same symptoms as you, lower abdominal discomfort. And I say that is crazy, number one, because if she's having the same specific symptoms as I am, is it the same thing, right? Because obviously we'll never know. I can't experience her symptoms. She can't experience mine. But she was describing them so similar to what my experience was like. And she went through a whole nother, journey with her healthcare, providers and antibiotics and, oh, it's this, or you tested negative for this, but we're still going to give you that. She went through her own journey. So I referred her to my doctor. And at this point, it's now January. She is on her own journey of her own. And we're confiding in each other. We're leaning into each other because we're both in the space of health anxiety. Okay. So now we have just looked at 7 months of not knowing what was going on, never getting a formal diagnosis, just living with symptoms, not really sure, where they're coming from. Is this a forever thing? Do I need to just kind of grin and bear it and accept it that this is going to be a part of my life? Now, there were moments of time where I was in such pain, like so much pain. And I think about that. I'm like, but this is not right. I'd have my good days and I'd be like, okay, I have my good days. This is good. But then on my bad days, I'd be like, but I cannot accept this. I cannot live my life and accept the fact that there are going to be some days that I'm okay and other days where I'm feeling so terrible and out of commission and so symptomatic that it's preventing me from working or focusing. That is not a life to live, and that is not the quality of life that I signed up for. And I hope that anyone listening here feels empowered by this, because no one deserves to live that way. No one deserves to live in a space of some days are good, some days are not so good. Now, I won't say that, all days are going to be wonderful, right? We all have our bad days, especially when it comes to emotions. But I think when it comes to physical symptoms, we don't have to just accept, well, this is just a part of getting older, or we're really not sure what's going on. So yeah, I don't know what to tell you, right? Which is very much the vibe I got over the course of the last 6 months of 2023. And I was determined to not allow this to be my reality. Okay, I was determined. I said, this is just no way to live. Now, I don't think I mentioned this at all throughout this whole episode, but I also have a gallstone, which was identified when I first had an ovarian cyst rupture in March of 2022. And at this point, the doctors at the ER said, you do have a gallstone, but don't worry. You don't need to do anything about it. Just eat a low-fat diet. And if you start to have pain, then we'll probably have to remove your gallbladder. Okay, so first and foremost, you can imagine the full body just like cringe that took place when someone said, eat a low-fat diet. No. Okay? Not happening. Now, if you're going to say eat a low-fat diet in terms of industrial oils and, processed oils and fried food and so forth, okay, yeah, that's fine with me. I can certainly do that. But a low-fat diet overall, no way. That's going to promote more dysfunction. That's going to promote more inflammation. I need to be eating fat in my diet. That is what we're meant to be eating. Okay, healthy fats in abundance. 60% of our brain is fat. Okay, so I'm not... No, not happening. Okay. So I said, yeah, okay. I'm going to do that. Low fat. Yep. No fat for me. Meanwhile, I'll have my fatty fish. Thank you very much. I'll have my avocados. I'll have my olive oil. I'm going to be happy about it. And number 2, I'm not getting my full gallbladder removed. I'm not doing that. Okay. That's not okay. Yes, we can live without a gallbladder, but the gallbladder is in the body for a reason. Okay, the gallbladder is in our body for a reason. We would not have a gallbladder if there was not a reason for it. Okay, It is a part of our digestive system. We can live without it, yes, but we don't want to live without it, is what I'm really, getting to here. Okay. So I'm now hypothesizing, could this be gallbladder related? I'm going to just sum up the last 2 months because I don't want to get too much further without getting to the point I'm trying to make about this whole episode. But just within the past 2 months, that health anxiety kind of revamped. I had a lot of middle chest pain. It felt like something was lodged in my chest cavity. I kept describing it as like a marble, or like, when you swallow a pill and it gets caught in your chest. Like, that's what it felt like. It felt very chest, upper abdomen, gallbladder location oriented, right? This probably started mid-February, and it was uncomfortable. Okay, it was very uncomfortable to the point where it was affecting my breath, to the point that it was really causing me a lot of discomfort, to the point of like, should I go back to the ER, right? And I kept being told by my mom, Emily, what are they gonna do? What are they honestly gonna do, right? So I decided to start working with a program called Kale Diagnostics, because at this point, the symptoms of the lower stomach issue were still kind of present for me. I'm having that center of the chest pain that, would come and go, but it definitely was not something I wanted to have to live with, right? Which, once again, we should not have to live with this type of experience. And I asked them, okay, I have a gallstone. This is kind of my health history of what's been happening over the past year. What can we do? So I started with them, and I was instructed by my integrative health doctor to go get an abdominal ultrasound. Okay, we just wanted to go get the abdominal ultrasound to see if something else was going on, knock on wood, but also to confirm that the gallstone was still there. Okay, because sometimes they make their way out. This has been 2 years now, so who knows, right? So at this point, I'm a ball of anxiety, because now I'm like, what is going on? Is there something going on with my heart? I'm Googling it. They say that gallstone issues can create non-cardiac related symptoms, which was kind of what I was experiencing. But of course, under your gallbladder or around your gallbladder, you also have your pancreas. You have other organs. So I'm thinking, okay, what is going on here? Is there something else happening? So I go to the ultrasound, confirmed, yes, we do have a gallstone, okay? Secondly, I'm being told I have fatty liver, okay? Now, this came at a complete shock to me. I had my ultrasound done, I don't really remember when this was, beginning of April, maybe, end of March. And at this point, the pain had subsided, but it was pretty much a week or two where it was very present for me, and I was once again filled with the anxiety about the what ifs, what's happening, and why don't I have more of an understanding of what's going on here, right? Because at this point, we're coming up on almost a year where all of this is happening, these symptoms are, appearing for a couple weeks and then disappearing, and I was trying to make connections. Is this cycle related, right? Is there something going on with my period that's causing this? There's a number of hypotheses, right, that kind of kept floating around, but all along, any dysfunction or any kind of symptom that I'm experiencing that I can't identify a root cause for, that was driving up my anxiety. So called the doctor's office. I had the ultrasound done on a Monday morning, I believe, at the hospital that I was born at. Okay, so I believe this is a trustworthy hospital, okay? And I am waiting all week for the results. Thursday morning, I decide I'm going to give a call because I need to know what's going on. I speak with the nurse. My doctor's not in, okay? And the nurse says I can only give you the medical diagnosis based on the report, and that's all I can give you. And she's like, I can't really tell you if this is bad or not, but the doctor wants to extend your appointment next week. So immediately I'm like, oh my God, what is happening? Okay. So she gives me the medical diagnosis for gallstones. She gives me the medical diagnosis for fatty liver. And what does Emily do? Emily goes right to Google and she Googles it, and now I'm losing my mind. Okay. So at this point, I relay this information to my naturopathic doctor, who I'm working with through this additional program. And she wants to know the size and the amount of gallstones. And she also says, we can't confirm that it's fatty liver. We'll have to see the full report from your doctor. So now I'm just begging at this point, before I got off the phone with this nurse, I said, can you please just have the doctor call me? Can you please have her call me? I know she's busy. I know she has a lot going on, but can you please have her call me? I just need to know what is going on. I cannot wait until next Thursday, which is a whole week, to talk with her, especially now that she wants an extended appointment. So don't hear from her Thursday. Don't hear from her Friday. Saturday, I'm at work and I get a call. I run out from behind the bar. I answer the call. It's another doctor, it's the nurse, but she spoke to another doctor, not my doctor, but someone else who could look at the results. And she said, yes, confirmed gallstone and fatty liver. So of course, I'm not pleased to hear that there's fatty liver, because that doesn't make any sense to me. And how, right? But I'm pleased to know that, okay, there is a confirmed gallstone, so that might explain the pain that I was having. So fast forward to my doctor's appointment the following week, and my doctor said, there's no way. There is no way that this is what's going on. She goes, your blood work is lovely. She goes, there's no insulin resistance. There's no issues with your blood sugar, which can create and contribute to this phenomenon called fatty liver. Now, fatty liver is most commonly found in those who drink a lot of alcohol or eat a lot of sugar, who are sedentary. It's a very common situation, and a lot of people don't know that they have it. But it can also be reversed. And I think that's what I was taking comfort in, was the fact that I knew it could be reversed. So we're throwing out all sorts of hypotheses at this point. I'm like, well, is it the gallstone that's causing it? Is it my gut health that's contributing to it? Like, what is it that's going on that's causing this? She goes, you need to do a follow-up ultrasound. She's like, you need to go back. There's something that's not right here. And they didn't give you the number and the size of the gallstone. So she made a specific notation. Please tell us about the size and the quantity, and then also please check for fatty liver. So I get an appointment for maybe 2 weeks from then, and sitting in my anxiety, okay, what could this mean? What's going on? Get the ultrasound. I myself take it upon myself to look online for the results, because your girl is not sitting around and waiting. If I can find out about this, I'm going to do it. Sure enough, the result comes back maybe 48 hours later. 2 gallstones, no abnormalities with my liver. No abnormalities. My liver's completely fine. So this really boils down to, it was a misinterpretation of my ultrasound report that led me into this anxious spiral. Okay, I had been on an anxious spiral for a long time. And I was feeling really frustrated by our healthcare system, which is not anything new, right? I think I've always felt frustrated by our healthcare system. And I was relieved, but I also wanted to understand. So I saw my doctor later that day, I believe. It was kind of coincidental or convenient. I go into the doctor's office. She goes, did you look at your report? I said, yeah, I did. So what's this about? What is this about? She goes, humans are humans and things like this happen. And I go, but how is this possible? Because just as a false reading can happen, things can be overlooked too, right? Things can be overlooked. And that is terrifying to me, to think that there can be, interpretations or readings of these reports that aren't, thoroughly examined, and we can be left with an answer that might not actually be the reality of the situation. So I left with my doctor, just trying to understand, and she kind of just dismissed it, like, this is just the way things go. And I was like, all right, well, I guess this is the way things go, but why does this have to happen? This should not be the case. Because if I hadn't gotten that follow-up ultrasound report, I would have literally never known. I would have gone about this really vigorous fatty liver reversing process in order to reverse something that wasn't even there. Now, it wouldn't have hurt me, right? It probably would have helped me in a lot of ways and reduced a lot of inflammation and so forth. But wow, yeah, talk about skepticism of our healthcare system. So I am now left right now with 2 gallstones that I'm working on dissolving. I just got all my supplements in this weekend. So I'm just starting the process now with working on dissolution of the gallstones. And I'm really excited to share more about this process and really commit to it and really invest in the time and the energy that it requires, and not to mention the financial investment that it also requires. But, I'm really hopeful about this process, and I'm going to be documenting it all along. So I'll probably document it on the podcast, honestly, which I think I just thought of right now. I should do like monthly updates on how things are going, but also over on Instagram and TikTok and so forth. I'll be very diligent about sharing. And then also with my GI map, there were a few things that came out that I'm also going to be addressing as well. So working on my gallbladder, continually supporting my liver health as well, which is a big part of health overall, but also because I know that I need extra support for the sake of my genetics. And then also looking closer at my GI report and being more intentional about adding in the right foods. I have some supplements I'm adding in. I'm back on a pre and probiotic, which is something that I really wasn't taking for many years just because I was getting it through a lot of the food that I was eating, but this one's specifically for the protocol that I'm following. And I'm just so excited. I have my whole setup. I have my supplement schedule on my fridge. And yeah, I'm really looking forward to this process. So this was such a long episode talking about health anxiety and my experience with it. And I want to just elaborate a little bit more on the concept of health anxiety, because I was not someone who was very anxious. Maybe as I went through my childhood, I remember having a lot of separation anxiety from my mom. Like when she'd go away for a trip, that was really hard for me. Even when she was homesick and upstairs in bed and my dad was responsible for taking care of us, I remember feeling very anxious about that. And, she would go work at night sometimes. She sold Longaburger baskets. I don't know if you guys are familiar with this, but because my brother and his illness, and his kind of fluctuating schedule with doctor's appointments and so forth, she didn't really have a consistent job growing up. She kind of just did a lot of different roles. And for a while she did sell baskets, and she'd go to the homes of these women who wanted to host a party, and she would sell baskets. And so sometimes I'd go with her and be her little helper and help her, but she would go and I would be so anxious about her being gone. And I think that this has now just followed me as I've gotten older, but it really didn't show up in terms of health anxiety until these past few years. And I think something that I have really tried to hold on to is trusting my body and trusting the way that I live my life enough so that I don't lose faith in the power of it to heal. Because I think that that's really what I feel disappointed in myself by, is because of the fact that I don't want to say that lifestyle is a cure-all, right? That's never the case. There's always chances that things can happen that are out of our control. Even if you're eating the most perfect diet and doing all the right things, right? I know stress is definitely a big part of this puzzle, and that's something that I'm constantly working on in my personal life and navigating that and managing that, and also with work and building a business. There's enough stress in that to go around. But I think what discouraged me the most was in this journey over the past year, I felt betrayed by my body. And I think that was not fair for me to do, because of the fact that I know that I commit to my health and my wellness every single day through the things that I'm doing, and not just in the foods that I'm eating, but also in the moments where I want to have a cheeseburger or chicken wings or ice cream or whatever, because that's what balance is about. And that one night where I have chicken wings is not going to dictate the illnesses and the symptoms that I have for months thereafter. That's just not the case, right? And I spent a lot of time frustrated with myself. Like, what did I do wrong? Should I have not done this? Was it that? And I think what it really boils down to is the trust that you have in your body. And I mean, as far as the mindset that you have around healing, that really makes a difference in this journey. And it's knowing I fuel myself properly. I know what true nourishment looks like. Yes, this is a scary time. This is an anxiety-inducing time for me. But I know through the investments that I make every single day that I will be okay. And I know that, like I said earlier, this is dramatic in a lot of ways, but this was such a real experience for me, and it really illuminated how much I do struggle with health anxiety. And I think a lot of it has to do with the fact that I'm very close to health. I'm very close to the health of others. I'm very close to the health, obviously, of my own. I'm very in tune with my body. And I need to work on strengthening the trust that I have in my daily practices, because I know to be true that lifestyle and nutrition play 90% and greater of a role in our health outcomes than any kind of genetic predisposition that we may carry. I know that to be true. I think it's 98% or 95%, something like that. So for me to be in a moment where that mentality was compromised, that felt very hard to navigate, because it felt like almost everything I was doing and everything I was preaching was a lie. And I know that that was simply driven by the health anxiety I was experiencing. Okay, I want to say that because in retrospect, when I can kind of look at it outside of that anxiety, it's much easier to see that those emotions and those thought processes and that feeling of, oh my gosh, my whole business and my whole existence and philosophy is now in question. I know that was coming from the emotion I was experiencing, the strong emotion of anxiety that I was having in that moment. So I don't feel that way anymore, by no means. And I'm still preaching that word, right? I'm still preaching, lifestyle, nutrition for mind and body health is essential. But I think when it boils down to this concept of health anxiety, it's a very real thing for a lot of us. And the stress that comes along with that is not going to serve you. It's not going to change anything. It's only going to make matters worse. 95% of illness is exacerbated by or caused by stress. So the more that you're allowing this health anxiety to consume you, the more that you're allowing this health anxiety to, overcome the faith that you have in your body, the worse it's going to be. The harder it's going to be to navigate, the less of an environment your body has in order to heal. If your nervous system is on overdrive at the thought of, well, what's this about? Why am I feeling this? What does this mean? Do I need to be doing this? And what did I do wrong? And so forth. Okay. And I think, throughout this whole episode, I hopefully illustrated what type of year I had. I know I don't share like a lot of this on Instagram. And I think it was because I was feeling a little bit ashamed. I was feeling a little bit, embarrassed by the fact that I was going through this, and I felt so anxious around it. But it really is a message that needs to be sent, because I'm sure that there's some of you that are listening that have had this same experience or will have this experience. And I hope that you know that you're not alone in it, and that there are a lot of different things that you can do. Now, I think one of the simplest things that I can suggest as well is really leaning into your self-care. Now, that might seem simple, but just as you would in any other difficult time, take care of yourself. I mean, self-care as a stress management, stress reducing strategy is going to help your body significantly, right? Just taking time to rest, taking time to decompress, staying away from Google, staying away from diagnosing yourself, all of these things, right? That is one of the best things that you can do just for your mental health, but also for your physical health as well. Because the least activated that we are, the more that we're in that relaxation space, our parasympathetic nervous system, the more our body can operate more smoothly. And the more that our body can work towards regaining homeostasis, which is ultimately the ideal space in order to digest properly, in order to heal, in order to prevent the exacerbating of the issues that might be there. Because there might not be as extreme of the issues that you're interpreting or that you're imagining, but through the anxiety and the stress that you're having around it, you're generating that cortisol, you're generating that inflammation, which is making it worse, right? And I know it's so much easier said than done, especially in my situation where I was just very unwell and very frustrated, and I felt very aloof. Like I felt like I was going through the motions of what I thought I had to do, or I thought my resources were, which were seeing these doctors, but not getting the answers. And I'll be quite honest, I still don't have an answer for what was going on. I still don't have an answer for the symptoms I was experiencing June, July, August of last year. Now, did I get a lot of diagnoses? Not formally maybe, but discuss a lot of diagnoses? Absolutely, right? I had a lot of healthcare professionals say this, say that. You should go see so-and-so. You should try this. You should do that. But what I know to be true is our whole body's interconnected. So whatever I'm doing for the sake of my gallbladder, I'm sure is going to then manifest in every other area of my body. What I'm doing to support my gut health, we all know 110% is going to then show up in my immune health, my brain health, my mental health, my hormone health, all of the things. I'm still waiting on a Dutch test, which is going to look at all of my hormones. So I'm looking forward to doing that. But it really has been such a journey for me. It's really, really shown me how much I value my health and feeling good, and areas that I need to work on in order to not allow situations like this to completely derail me, because that was really what was going on. Really, wholeheartedly, that was what was happening. And I need to trust myself. I need to trust what I'm doing and how I live my life, and how I am very intentional about the choices I make nutritionally, and the movement that I invest in, and the time I spend investing in my quality of sleep, and all of the things. That is so important to me. And I think for some time I felt very discouraged, because truthfully felt like, what's the point here? Right? In the midst of the anxiety, can convince you like, what's the point? Well, what is the point of this if I'm still having these symptoms and they can't identify what it is? And then I also hope that this helps you advocate for yourself. Okay, that's what I'm going to leave this episode with. In the midst of the health anxiety, I want you to, instead of run away, which I think is what we want to do, we want to maybe just run away from it, I encourage you to face it head on. And what that looks like is, I'm feeling this way about my health, and I have options in terms of who I can go see for support. And if you are not happy with the individual that you're working with, if you are not happy with the experience that you're having, find someone new. You have to be your own advocate. You are your own best doctor. And at the end of the day, you know your body best. You know your body best. And if you're not getting the answers, or you're not happy with the course of treatment, or you're not happy with the way that they're going about their choice of care, you are fully entitled to go find someone else. And this is one of the biggest ways to combat health anxiety. Take action. Take action. Anxiety can be paralyzing. And I'm telling you, this is what it felt like for me. It was paralyzing. So in those moments of paralysis, of just wanting to shut down, the best response, or the best opposite reaction to that anxiety, is to act. It is to act. And that means finding a healthcare professional that is best suited for you. It might take time, it might take research, it might take financial investment, right? But ultimately act. And I want you to also take time, if you know I invest in my wellness every day, which we all should be doing, okay? If you haven't heard me say that before, you know that's how I feel. If you take care of yourself nutritionally, if you move your body, if you get quality sleep, if you supplement according to your needs, right? Which is important, which is a big part of a balanced lifestyle. If you do all these things, remind yourself of those facts because those are powerful pieces to your puzzle. I lost touch with that. I lost sight of that because I was so distraught about what was going on, and my health anxiety came in full force during this time. And I completely neglected the fact that, Emily, you have been actively investing in your health for years and years and years and years. And maybe there are some situations going on from past history, from, situations and the way you took care of your gut and so forth from years past that are now maybe catching up with you. There is so much evidence and so many facts that you can hold on to that immediately negate any of these irrational thoughts that are coming up for you that are causing you distress. So really looking at what your thoughts are saying, really reframing them, looking at the facts of the situation, practicing self-care, and advocating for yourself. I think those are among the few options that I can suggest to you right off the bat if you are someone who experiences health anxiety. And this is something that I didn't know if I was ever going to share over the course of the past year of what I was navigating. And I don't even know if I intended on sharing the whole story in this episode. I really wanted to just talk about health anxiety, but I think that through my experience, that kind of showed through, right? Through my experience, I was able to kind of illuminate that concurrent experience emotionally that I was having that was causing me so much distress, that was causing me so much, discomfort amidst already the discomfort and the symptoms I was experiencing. And I'm hopeful that some of the suggestions that I made will help you. And I'm going to continue to, as I navigate this gallstone journey, as I navigate my own wellness journey, which I imagine there's going to be plenty more experiences to speak on in the future as my health unfolds and as my life evolves, because we are not static creatures. We're always changing, we're always evolving, and we're always encountering different parts of our health, right? And so we have to be willing to say, okay, you know what? The insurance that I invest in, right? The insurance as in drinking good quality water, moving my body and building muscle mass, eating nutrient-dense rich foods, sleeping properly, and so forth, right? All of those basic foundations to health is the insurance that I am investing in for moments like this where I feel like something's not right, something's out of whack, but I know that the environment and what I do in order to take care of myself is going to help pull me through. Okay? So to sum it up, to give you them kind of rapid fire once again, check the facts. Look at your facts. What facts do you have? Are you making up facts? What are your irrational thoughts telling you? Can you look at those a little bit differently and reframe them? This is a big part of the work that I do with clients is, looking at the thoughts about something and saying, okay, are those irrational? Are they rational? How can we reframe them and how can we look at them differently? Lean into your self-care. Super, super important. So incredibly important just for the sake of navigating a stressful time, but also mitigating the effects that stress can have on the body. And then self-advocacy through and through and through. That is always going to be, a suggestion that I make. And, being patient with yourself, being gentle with yourself. As I said, life is an ongoing journey. Our wellness journey there's no destination. For me, the destination for this gallbladder thing is to dissolve my gallstones. But as a whole, and as an overwhelming kind of journey, there's no end. It's simply just me moving through my life and what I have going on and navigating circumstances and challenges and symptoms and so forth as they come about, and doing it in a way that is most supportive of my whole body and most aligns with my philosophy as a human being as it relates to health. And that is what's most important to me, is that I'm continuing to honor that. I'm continuing to lean into that, because that's what I believe. That's really what I believe. So I appreciate you. I appreciate you for allowing me the space to be vulnerable here, to talk about my experience over the past year. I may have missed some things. I don't have anything written down here. I kind of just recalling based on how I saw the year unfold. And as I said, my gallbladder situation will continue to be shared upon. Not the most glamorous journey, right? I think we can all agree. Not the most glamorous, but still important, because it's a part of my journey. And this podcast, my platforms are about sharing my journey and obviously sharing more on health and so forth. But I think it would be inauthentic of me if I didn't share also this part that, I have to do and I'm doing now and I'm excited about. And maybe it'll help you too. So thank you so much for being here once again. It means the world to me that you tune in and you listen every week. And if you have questions for me, or you want to connect, or you yourself are someone who has navigated health anxiety and you feel like that's a real experience for you, please let me know. I myself, from personal experience, know what it's like, but I also was a therapist at one point in time, and I worked with anxiety in a number of different ways. And so I can empathize with you and I can support you in the best way that I can. And it's a very, very real experience. I totally, totally understand. And I've been there and I get it. And it's something I'm going to continue to navigate on my own. But I hope that this episode brought you some peace. It helped you feel less alone in your experience. And I hope to see you at my table next week. In the meantime, be well.